Hello, everybody. Welcome to 2023. I'm really excited to have these conversations with my specialist colleagues such that we can bring some valuable information to the bariatric community that we serve. My guest today is Paul. Paul is not only a good friend and a colleague, but also he has given me some personal advice when it comes to developing an exercise plan. Paul is a passionate exercise physiologist who is qualified in Masters in Clinical Exercise Physiology from Deakin University. He currently is the principal exercise physiologist and the medical partnership coordinator at Kieser Caulfield. And he's somebody who I have personally consulted, as I said, and I truly believe that he's extremely passionate, but more importantly, he's very practical in his approach when it comes to talking about exercise, its relevance, and also incorporating it in an individual's busy lifestyle. So I'm fairly confident. I've got a lot of things to read about his bio, but I won't bore you about him because the man himself and the conversation that we're going to have now is going to bring to light the relevance that exercise has, regardless of whether you are considering weight loss surgery, you've had weight loss surgery, but we are going to be talking predominantly in the context of an individual who may have had weight loss surgery. So Paul, thank you so much for sharing your time with me. I truly appreciate this, and I'm sure the audience is going to benefit greatly from your presence.
Thank you very much, and thanks for your very kind introduction.
Lovely. So I guess with that, Paul, we all know that exercise is important. All right. Everybody knows that it's good to exercise. It's good for your heart. It's good for your sort of your bones and your joints and all of that. But I guess, sometimes too much information on that side causes us to become paralyzed. Somebody says, do this exercise. Somebody says that do that exercise. And we get confused. And I know a confused mind doesn't take action. So tell us a little bit about why should exercise be an important or an integral part of a person's routine, just like sleeping should be, just like food should be.
Yeah, 100%. You're definitely right that there's a lot of information, a lot of misinformation. Now in the social media age, a lot of influencers pushing different things as well. So it's a very, I can understand from that perspective, it can be very, very difficult to understand what you should do, what you shouldn't be doing. At the end of the day, for everyone, exercise should comprise an important aspect of your lifestyle throughout the lifespan. We know that your activity and your ability to be active is one of the strongest predictors of not only living longer, but living healthier for a longer period of time. So that's what I'm passionate about. I'm passionate about ensuring that people find the right activity for them to make sure that they can be as active for as long as they need to be, but in a very sustainable way. I don't necessarily believe in these 6 to 12-week programs because they end. Exercise should be a part of the lifespan, and it's allowed to be very adaptable. There's no one right way to exercise. There's no right specific thing you should do. There's Pilates, there's yoga, there's swimming, there's gym, there's home programs.
Yeah.
Nothing's better or worse. It's about the consistency and the application of exercise. That's the most important thing. And then finding something that you do find somewhat enjoyable, because it has to be sustainable.
And we'll get into that, aspects of different types of exercises in a moment, Paul. But tell me, a lot of people that I come across and I speak to use exercise as a weight loss strategy. They say, you know what, I got to do exercise because I got to burn the calories, And I think I have a fundamental issue with that. I believe exercise is a great fitness strategy, but you can't say that because I binged on the sticky date pudding last night, I can work an extra hour of gym today to make up for the calories that I've. It doesn't work that way. That's my opinion. What do you say?
Yeah, you're completely right from that regard. If you take that approach with exercise and apply it to that context, you're going to find your progress towards your goals is going to be very limited. There'll be no progress at all in regards to that. It's a very short-term minded way to think about exercise, and to be honest, it's probably the incorrect way to associate exercise and your exercise routine. Firstly, just from a general sense, we should be thinking of firstly utilizing exercise for our health, But then definitely from a vanity perspective, it's more about what you actually do in a particular exercise session or what your exercise regime looks like that's going to contribute towards a weight loss goal rather than how many calories you actually burn in the workout. Because that's actually not how indicative, that's not how, sorry, that's not how a program is going to get you towards your goals in the long term anyway. It's not how many calories you burn in a session. It's actually more about what the structure of your program looks like and what the goals.
Yeah. And I think, Paul, also, there was this, the biggest loser, we all know about it, they took all these overweight people and they got them to exercise so hard, like they literally shocked the living daylights out of them, and to see how much they lost. But when they followed these patients up, they actually found that almost 87% of them had regained all the lost weight.
It's unbelievable to think about, isn't it? And I tell a lot of the people I see, I think the biggest loser was probably one of the worst things for exercise to go around and make people feel like they had to be crawling on their hands and knees at the end of a session for an exercise session to be effective, which is completely false.
Yeah.
Again, not sustainable. We can probably do that every now and then at most, but everyone, it's not a sustainable thing to do in the long term.
But I think, Paul, the other concern also is for a person whose BMI is very high to be exercising to that degree is that they put themselves at a risk of injury. And we know that once you are injured, like a ligament injury or bony injury or whatever it may be, you are paralyzed for, when I say paralyzed, I mean you're bedbound for 6 weeks. You can't do anything and you just eat.
And then your progress that you want to do is halted. Because at the end of the day, most injuries do occur due to a muscle, like tissue, ligament, or tendon receiving a stress that it's not accustomed to receiving. So if you're going hell for leather, start, you're not allowing your body to appropriately adapt to that stimulus, which our body will do in time, but you've got to do it in a smart and correct way.
Yeah. So if I were, just to give you a hypothetical scenario, if I were an overweight person who was struggling with weight issues, what would you advise to me with regards to, say, developing, what should be the broad blocks of exercise, or if I wanted to draft an exercise plan with you, if I came to you for advice?
Yeah.
I'm talking about the big picture and then we'll go into micro.
Yeah, for sure. So definitely, I think the first thing to be aware of and understand are what are the actual guidelines. If your goal is weight loss, what are the guidelines towards weight loss? So it's broken down into two streams. We look at aerobic exercise and we look at resistance exercise. In amongst all that, you can also do other things. Aerobically speaking, we want to be working over a weekly trend. We want to be working towards 150 minutes to 300 minutes of aerobic exercise. If you're not doing that at the moment, say you're doing nothing, that's completely fine. But how can you look to build up towards getting towards that guideline?
So 300 minutes a week, did you say?
Yeah. 150 to 300 minutes per week. Yeah.
And that works out to, say, about 40 minutes a day?
So between 30, like if you're looking at a 5-day week, potentially 30 minutes to an hour per day. The body
30 minutes to an hour per day. Okay.
Yeah, the body doesn't care how you accumulate that 150 to 300 minutes. If you do 15 10-minute walks, which equals 150 minutes, that's no better or no worse than 5 30-minute walks. So shorter bouts of any kind of activity is just as effective as one longer bout. So it's not necessarily an all or nothing approach. Yeah, it's not an all or nothing approach. So if you think like 10 to 15 minutes isn't worth your time to go for a walk, the science pretty incredibly disagrees and says that there's a dose-response relationship with aerobic exercise. So the more you do, the better the
And this is an extreme scenario. What if someone said, I want to just exercise one day in a week and just crush like 5 hours, and then don't do anything. Sorry, I'm just giving you an extreme example. But this may be running through someone's head. Who knows?
So yeah, like if you want to be, like we call those the weekend warriors, typically the ones who smash out everything on the weekend. If you want to do the bulk of your exercise in one bout, there's obviously probably not the most ideal strategy, but there's also nothing wrong with that, providing what we spoke about earlier, you give your body time to adapt. So I wouldn't just go out and do like a 3-hour walk if you haven't done a 3-hour walk ever. Maybe think about doing 30 minutes for the first month, then 45, then an hour, just to allow
and build it up.
Yeah, it's more for your tendon health, because tendons after a month or a couple of months can actually become quite aggravated. It's not because you walked that weekend, it's because you did a whole lot of walking the month before. So it's allowing the body to adapt and adjust.
Sure.
Um,
All right.
so
So sorry, I'll let you continue because that was a pertinent question at that point.
yeah,
So you were talking about the aerobic exercise. So
yeah,
we aim for 150 to 300, then progress to 300 minutes in a week.
yeah, yeah, for sure. And that's the goal with that. There's other things we can get into the intricacies of intensity, but that may
Hmm.
be potentially for another time. But there's intensity can factor into that too, where you don't have to potentially work for as long if you work harder in that bout.
Yeah.
Then we want to look at, and what I would argue is more important, is looking at muscle mass and strength training, uh,
Hmm.
which is a very, very important component of weight loss, which, and to go back to your example before, strength training won't burn as much calories in a workout as aerobic training, but it's
Hmm.
actually going to be more beneficial in the long term in terms of getting you towards your goals. Because what happens with muscle is an active tissue. So muscle burns energy to keep itself there.
Yeah. Yeah.
When we don't exercise, our muscles get smaller because the body's thinking, why would I burn energy if this person's not using muscles? Our body still thinks trying to like hunt a deer later tonight. It doesn't realize we have food in the pantry. So it's truly trying to conserve energy.
Yeah. And I
So
think just on that note, sorry to interrupt you,
yeah,
Paul, but I think the relevant point that you're saying is that, in obese patients, there is this condition called as sarcopenia,
yeah,
which is loss of muscle mass,
yeah,
which happens because of the fact that they're not using as much muscle
yeah,
at all. So they are bigger in size, but the muscles are weaker, and that's a very important condition. So yeah, I think building muscle mass with resistance training
sure.
is so important, especially in the bariatric
Yeah,
patients.
definitely.
So yes, I'll let you continue, please, over there.
No, no, definitely. So the focus of that is you exactly what you said. You want to maintain, like not maintain if you've had the surgery, or slow the loss of muscle mass. But if you're just in the phase where you haven't had the surgery, build your muscle mass is what you're doing. If you
Yeah,
build your muscle mass, you're actually increasing your metabolism. You're increasing the amount of energy that you burn, not in the 1 hour of your workout or the half an hour of your workout. You're actually burning more energy in the 23 other hours that you're actually not exercising.
yeah,
So you're actually boosting, and I think I saw in a research article, I think for every 1 kilo of muscle you've got, you burn 100 calories, for example. So think about if you lose that muscle, how much it can influence your ability to lose weight, but then it can increase that, how much that can help with weight management as well.
I often say it's on a slightly lighter note. I often say that endurance training or resistance training is like building a passive income stream. You
Yeah,
do the active work while you're setting it up,
yeah,
and then it pays you for the next 23 hours.
yeah, for sure. And that's why it's completely incorrect to look at calories burnt in a workout, because
Yeah.
it's what this 1 hour in the day is not going to change 23 hours. Like, it's about what you can do for the 23 other hours of the day.
Hmm.
So the focus of that is definitely building muscle mass. But what happens as well is, if you are in the phase where you're losing weight,
Yeah.
there's been research now on dieting alone versus diet and exercise. What we know now is if you just diet, you lose muscle and fat. If you diet and exercise, you lose more, you preserve more of your muscle mass effectively. So you lose more fat mass. And therefore, what that does is, because you've got more of your muscle mass, you're actually burning more energy again,
Burning more. Yeah.
preserving more of your metabolism, which is going to allow you to sustain longer term results, which was the issue when you speak about the Biggest Loser. Not the issue, there's multiple issues with the Biggest Loser.
Yes.
One of them was that they lost a hell of a lot of muscle mass. So their metabolism went right down. So they
Yeah.
were basically flogging them in their exercise sessions. They were restricting their diet. They lost a lot of, and they were in that sarcopenic obesity, what we spoke about. And it just,
Correct.
unfortunately,
Yeah.
wasn't a sustainable way to lose weight in the long term.
Correct, yeah. So talking about the bigger categories of exercise, you talked about aerobic,
Yeah.
then you talked about endurance training or resistance training. Can I ask you a question about high intensity interval training? Because HIIT gets a lot of attention,
Yeah.
right? F45s,
Yeah.
and all of that. So what is your opinion about it? And I'm talking in relevance to the bariatric patient.
Yeah. Yeah, for
Just
sure.
because of their high BMI, my concern is around risk of injury.
Yeah, no, for sure. I think that's a very, very appropriate concern to have. So I think in those particular contexts, yes, the issue is that there's often very little thought given to, like, unfortunately, in those environments, very little thought given to exercise experience, exercise history, and whatnot. And therefore, we can get, after this, like, first 2, 3, 4 weeks, you're loving it. It's really fun. It's really tense, we're loving it, we're feeling sore after our workouts, but that sort of tendon health hasn't had a chance to adjust to this rapid increase in load, which can happen for high intensity. Because the nature of high intensity is it's hard work. It's very demanding for the body. And if the body hasn't been exposed to that stimulus and you're just putting it on the body it's a lot of stress for the body to go under. And therefore that health of your joints, the health of your supporting structures gets put under a lot of stress. And that's where we flare up our increased risk of injury. And that's without even going into potentially, you haven't even been properly taught how to actually do what you're doing. So biomechanically, you're putting a stress on your body that it's not used to as well. So there's a lot that goes into it for sure.
Exactly. So, I mean, coming back to our bariatric patient who's had weight loss surgery, what do you think you would advise to them? What are the things to focus on? And I've not touched upon exercises like, which I call them flexibility exercises like yoga and Pilates. We'll maybe talk about that later on. But to keep it more streamlined, what do you advise? How do you approach a bariatric patient who's had weight loss surgery, say BMR 45? What would be the priorities and how would you structure a plan for them?
Yeah, for sure. So we're talking in the context they've had the surgery, is that right?
Yes, after surgery.
So I think the big thing is understanding that you've got your restrictions in place initially. So initially speaking, you don't want to be doing it again, unfortunately, that muscle building activity, because it's just going to, unfortunately, might cause some complications, which you might not be happy with as the surgeon. So we definitely adhere to that. Initially speaking, you want to focus on, you've got to take into account, you can have this energy, like your energy level is going to be quite low because your caloric intake is low as well. So it's a massive consideration. But you want to focus on basically just walking to whatever your tolerance level is. And everyone
aerobically
speaking, everyone that's going to be different, which is the sort of the art of what we do. But some people are fine. Some people actually don't think they've even had the surgery, like they don't even realize they've had it. Like they can go out and start walking 45 minutes to an hour. Some people they're wiped with energy. So firstly, it's establishing what are they doing at the moment, and how can we look to build in a progressive way towards what I said the guidelines were, which was that 150 to 300 minutes per week. It's looking at what we're doing now, how that fits in with the guidelines, and how we can get towards the guidelines. And then obviously people have motivational issues, trying to work around that and how we can potentially factor around different thoughts about exercise and how we can try and find something that's a bit more sustainable for that individual.
And Paul, with the target that you have mentioned, 150 to 300 minutes for aerobic exercise, is there also like a target heart rate that they need to achieve, or is it just time bound?
It's a good question. So you can get into heart rate and heart rate percentages. For most people, it's a bit, some people are very analytical and they love that, which is completely fine if you can get into it. For most people, what I would advise is probably just immediately after surgery, just focus on moving, which is what I would say, like for the first, even like 2 to 3 weeks, just focus on moving. Don't worry too much about that. After that, maybe 4 or 5 week mark, if you're feeling good, I just like to think of it as the talk test. Which is a nice measure of intensity. So if you do the talk test, basically, if you can do your walking or whatever aerobic activity is at an intensity where you can talk, but you can't sing, that's usually a pretty good intensity to work at. You should be able to have a conversation with whoever you're next to, but you shouldn't be able to sing your favorite song as you're doing that. So that's a nice measure of intensity.
Talk test, TALK, talk test.
Just like talking, the talking test. Beautiful. So as a guideline, that's a nice intensity that we're working at. Initially speaking, I would just focus on getting out, moving, walking. If someone that doesn't like exercise and you really hate it, just go out and walk. Don't even think about the talk test. If you want a bit more challenge, think about that talk test, but just get out. That's going to be the most beneficial in the long run. Weight loss surgery, and then even your cardio metabolic health as well.
Awesome. That's great. And that's what I generally tell my patients, that after surgery, up to 8 weeks after surgery, focus just on cardio or aerobic exercise, which includes things like, exercise bike. They could do cross trainer, they could do walking, and then resistance training comes after 8 weeks from surgery, which is working on the core muscle exercise and all of that. Okay, that's awesome. Paul, this may not necessarily be an exercise related question, but I see a lot of patients who are obsessed with protein. Now, I understand this is a diet related question, but I struggle a lot, and a lot of my emphasis is on educating patients that nature loves balance. Your
Yeah.
body loves balance. You got to give yourself adequate protein, carbohydrates, and fats. Is this something that you get asked as an exercise physiologist, that I'm taking this protein supplement? What do you think? Is it going to build muscle more? So, your
Yeah.
views, please.
Yeah, I'm on the completely same wavelength as you in that regard. I think balance comes best. Balance with exercise comes best. Balance with diet comes best. You can't do too much exercise. You can't overemphasize one and leave out other macronutrients as well. So completely on the same wavelength as you. Um, I get a lot of questions about, do I need to take this protein powder before or after a workout? Should I be taking creatine before and after a workout? A simple answer to most people is for the type of exercise and for the goals that you're looking to get out of your exercise, the short answer is basically no. Unless you're looking for this exceptional boost in performance, which is what potentially what an athlete might be looking for, what a bodybuilder is looking for, to get that extra little bit of an edge, 1 to 2% that they need in their given.
Yeah.
For the population, for the bariatric population, I would say it's not as important as just focusing on being really consistent. The best thing you could do is just be this week to next week to month, just focus on the consistency of trying to do the small things right very, very consistently. So that would be my sort of thoughts on that one.
Beautiful, beautiful. And that's really good, because I think especially the younger patients I see have got an obsession for protein.
Yeah.
And they just love talking about protein. And I think excess of anything is bad, So, okay, we're going to leave it there. Now, talking about exercise in the form of yoga, in the form of Pilates, is there a role for that? That's the first question. And how could a patient who is keen, or when I say patient, I mean, let's say a bariatric patient who's now slowly regaining their, exercise tolerance, doing regular aerobic exercise, and also a bit of weight or endurance or resistance training, how can they get into, is there a relevance, and how can they incorporate, because it involves stretching and things like that?
Yeah, definitely. So yeah, whilst you're right, it's not like a formal part of the guidelines. I think that form of mobility work, and then even like targeted core strengthening work through Pilates and things like that, I think is a very, very important part of just like a holistic program, definitely. So as I said, whilst it's not like one of your big boxes that you tick off, it's a very, very important supplementary area with yoga and Pilates, I would say, definitely in terms of maximizing, like your mobility and your flexibility and your joint range of motion. Like I know a lot of people, one of the big reasons they have surgery is they want to be able to get off the floor. And part of having that is having that requisite range of motion that's required with that, which would include like stretching and mobility. So that could either be done in the form of yoga in itself, or it could be done as part of like your strength-based
your stretches and exactly.
Which is, for everyone, might be very individually tailored. Like I know for myself, my hips are I've got long legs, so my legs are very tight, for example. But some people, the opposite. Some people, they're like upper back's quite tight after a lot of sitting. I know you as like a surgeon, you're probably like in this position a lot.
Upper shoulder,
through here and things like that. So everyone, it's different, but as part of an individualized plan, it's definitely a good thing to include in, for sure.
So your work, like, what kind of work you do, whether it is predominantly sitting, standing, upper body work, lower body work, has to factor into customizing. And that's where I think customization is very important, to be able to suit your needs, the individual's needs, I should say.
Yeah, 100%. Like we all live different lifestyles. We all live different, we all have different occupations. Like some people are desk workers from 9 to 5. Some people are tradies, and like the goal for both is different in terms of like a mobility or even like a strength-based program. Someone who's an office worker, they probably have to focus on more and try and get their general activity up, because they're just moving less throughout the day. So you got to and that's included in just like the dose of exercise, the frequency, and that also includes the what you actually give them as well.
Yeah, beautiful. That's awesome. Paul, I think, what you have given us in this short span of time is really a beautiful framework of, if anybody listening to this conversation can get some really good nuggets of how to incorporate exercise, because I often say, especially to women who are, this is relevant to men too, that, the biggest risk of death in individuals above 65 years of age is the risk of fall.
Yeah.
And risk of the femur fracture and all of that. And the thing is, the only thing that can prevent you from that is having good muscle mass.
Yeah, for sure. And just to give a bit of context too, from the age of 30, we all lose about 3 to 8% of our muscle mass per decade.
Wow.
We have sufficient muscle mass in our 30s, 40s, and 50s, sometimes our 60s, to get away with that.
Yeah.
Losing muscle mass. But a lot of times in our 70s and our 80s, where we haven't addressed our strength declining biologically through strength training, but we haven't addressed it. So that's when we are more likely, you're right, to have a fall. And the most common mechanism of a fall is a trip or a stumble. And
Correct.
that's because of strength. Like if you're walking around and you clip your toe, your ability to catch yourself as you walk is a very, very important part of, it's actually not so much like balance that's an issue, it's actually strength.
Correct.
Hold yourself up on your
to
leg.
hold yourself up. Correct.
And that's the most common mechanism of fall. And you touch on it as well. Like the stats are pretty scary of people who have fallen fracture in their older life. There's some pretty worrying signs about stats, a percentage of time not leaving the hospital ever, and things like that. It's quite frightening. And that's due to a loss of strength, because we lose mass, we lose that strength considerably. And then unfortunately for women, that the loss of muscle mass is a bit more rapid than men.
Exactly.
Men hold on to it a little bit better. We still lose it, but women definitely a lot more. So it's
And this is over and above all the other benefits of exercise, like self-esteem, for mental health, or we didn't even touch on that. But I mean, the point is that, how do you incorporate this? So, Paul, I think I would say to you, thank you so much for, how can people reach out to you? What's the best way, and we will put it in the show notes so that people are able to reach out for advice.
No, definitely. So if you are interested in finding out more or delving into all this a bit further, more than happy for you to email me personally. So that's Paul, my first name, Paul, dots, my surname, which is Sansonati, which is a bit of a tongue twister, but SANSONETTI @outlook.com. Happy to do that. And then alternatively, happy to go through the team down there as well, and then they can shoot me through an email that someone's potentially interested in talking further. Beautiful. I'm also on the Facebook group as well.
Yes.
So if you inquire me through there.
This is the Center for Weight Loss Facebook support group. That's awesome. We can certainly put the show note in the links in the show notes, so anybody who's interested, they can reach out to you. Paul, thank you so much for your time. I really appreciate it. And the service that you're providing to not only our patients, but to the broader community is much appreciated. Thank you so much.
No worries. Thank you very much for having me. Much appreciated.